Today, we'll discuss how to evaluate and grade hydronephrosis on ultrasound using the updated urinary tract dilation classification system. This standardized approach helps us communicate findings clearly between radiologists, pediatricians, and urologists, and guides management according to risk. We'll focus on how to measure the anteroposterior diameter of the renal pelvis, understand the parameters used in grading, and define the features of each UTD grade. By the end of this lecture, you should be able to describe the correct way to measure the anteroposterior renal pelvic diameter, APRPD, identify the 6 parameters used in grading, distinguish between postnatal grades P1 or P3, and interpret their clinical implications. The UTD classification is a unified system for describing urinary tract dilation in fetuses and infants. It includes antenatal, A1, A2, 3, and postnatal, P1 or P3, categories and uses 6 descriptors: APRPD, calyceal dilation, parenchymal features, urethral dilation, and bladder abnormalities. APRPD is the maximum intrarenal width of the renal pelvis measured in the transverse plane. For antenatal scans, the fetal spine should be closest to the transducer. Postnatally, prone positioning improves accuracy. Measure within the renal parenchyma and avoid including the extrarenal pelvis. Document the largest valid intrarenal diameter. Illustration demonstrates acceptable intrarenal locations for measuring anteroposterior renal pelvis diameter. The largest APRPD should be used for urinary tract dilation classification, and in this example, the largest measurement is indicated with a solid line, which happens to be located at the junction of the intrarenal and extrarenal pelvis. In postnatal studies, the intrarenal and extrarenal pelvis should be readily distinguishable. In antenatal studies, in contrast, the intrarenal and extrarenal pelvis might not be distinguishable. Therefore, it is acceptable in antenatal studies to report the largest renal pelvis diameter, even if it is extrarenal. Measuring anterior, posterior renal pelvic diameter, APRPD. In transverse US images of the right kidney in a 22-day-old girl. Demonstrating severe peripheral calyceal ballooning dilation with thinning of the renal cortex. A APRPD is measured incorrectly at a narrow intrarenal diameter, 4 mm. B. Same image. When determining the APRPD, start by marking the edge of the renal parenchyma, arrows, and drawing a line connecting them to demarcate the edge of the renal parenchyma and the definite limit of the intrarenal pelvis. The dashed lines indicate valid intrarenal measurements, the largest of which is indicated by the arrows. See same image. The correct APRPD is 16 mm and represents the widest intrarenal diameter. The presence of thinning of the cortex with urinary tract dilation indicates urinary tract dilation, UTD, classification P3. Urinary tract dilation, UTD, classification P, normal. A. B. sagittal, A, and transverse, B. Ultrasound images of the right kidney in a 23-day-old boy demonstrate right pelvic distension with the anterior-posterior renal pelvic diameter measuring 4 mm. The calipers mark the upper and lower poles of the kidney. The APRPD is the widest intrarenal measurement in the transverse plane. The border of the pelvis is smooth. There is no calyceal dilation. The renal parenchyma appears normal with normal corticomedullary differentiation and normal hypoechoic pyramids, outlined. These hypoechoic pyramids should not be confused for anechoic dilated calyxes. The bladder is normal and there was no urethral dilation, not shown. Because the APRPD is less than 10 mm and the parenchyma appears normal. This is an example of UTDP, normal. Illustration demonstrates the features of central and peripheral calyceal dilation on postnatal ultrasound. The identification of any peripheral calyceal dilation, regardless of cupping or ballooning, corresponds with urinary tract dilation, UTD, classification P2. Although ballooning indicates greater dilation of the peripheral calyx than cupping of the peripheral calyx, ballooning alone does not upgrade the UTD P2 classification. The only way for United P2 to be upgraded to UTD-P3 is if there is associated parenchymal thinning or abnormal echotexture, bladder abnormality or oligohydramnios. UTD-P1 shows mild dilation with normal parenchyma. UTD-P2 indicates peripheral calyceal or urethral dilation with preserved parenchyma. UTD-P3 shows parenchymal thinning or bladder abnormalities, suggesting higher risk of obstruction. The image shows urinary tract dilation classification P1. A. B sagittal, A. And transverse, B. US images of the left kidney in a 16-day-old boy. Demonstrate left pelvic distension with an undulating contour of center. Trawl calyceal dilation, arrowheads. On the transverse image, B. The anterior-posterior renal pelvic diameter measures 8 mm. Notice how the dashed line is the correct measurement because it is the widest intrarenal diameter, bounded by the edges of the renal parenchyma. The sonographer's calipers, plus, are incorrectly placed because they include a part of the extrarenal pelvis. The bladder is normal and there was no urethral dilation, not shown. Even though the APRPD measures less than 10 mm, the presence of central calyceal dilation indicates UTD-P1. Urinary tract dilation classification P2. A. C sagittal, A, B, and transverse, C. Ultrasound mags of the right kidney in a 27-day-old boy demonstrate peripheral calyceal cupping, curved lines in A. These are distinguished from the hypoechoic pyramids, arrowheads. In B, although the anterior-posterior renal pelvic diameter, APRPD, the widest intrarenal measurement in the transverse plane, C, measures 7 mm, the presence of the peripheral calyceal dilation indicates UTD-P2. The bladder was normal and there was no urethral dilation. Not shown. Urinary tract dilation classification P2. A. C sagittal, A, and transverse, B. Ultrasound images of the left kidney and transverse image of the bladder, C, in a 16-day-old boy demonstrate peripheral calyceal cupping and 5 mm anterior-posterior renal pelvic diameter, B. The distal left ureter measures 6 mm in diameter, C. Either peripheral calyceal dilation or hydroureter with pelvic distension is sufficient to be classified as P2. Hydroureter alone would not be classified by the UTD classification system. Urinary tract dilation classification P3. A. B sagittal ultrasound images of the right kidney in a 22-day-old girl demonstrate severe peripheral calyceal ballooning dilation, shapes in lower image, with thinning of the renal cortex. The presence of thinning cortex with urinary tract dilation indicates UTD-P3. Urinary tract dilation classification P3. A. C sagittal, A, and transverse, B. Ultrasound images of the left kidney and transverse image of the bladder, C, in a 33-day-old boy demonstrate peripheral calyceal ballooning dilation, oval in A, with a normal renal cortex. The anterior-posterior renal pelvic diameter, APRPD, is 7 mm. Measured at the widest intrarenal pelvis in the transverse plane, B. Note that the large extrarenal pelvis is not measured for the APRPD, the left kidney is not shown. Although these two features would indicate UTD-P2, the presence of bilateral ureteroceles, arrowheads in C, in the bladder indicates UTD-P3. A ureterocele is cystic dilation of the intravesical ureter, and although it is a part of the distal ureter, it is considered a bladder abnormality in the UTD classification system because it is seen when visualizing the bladder. The ureters were dilated, not shown. UTD grading predicts outcomes and guides management. P1 cases are typically benign and monitored. P2 requires voiding cystourethropy or further evaluation. P3 needs urology referral due to high risk of obstruction or dysplasia. Accurate anteroposterior renal pelvic diameter measurement forms the foundation for correct grading. The UTD classification improves consistency and communication. Increasing grade from P1 to P3 indicates increasing severity and clinical concern. For additional details and clarification, please refer to the article published in Pediatric Radiology titled 2021 Update on the Urinary Tract Dilation, UTD, Classification System, Clarifications, Review of the Literature, and Practical Suggestions.